Renee Moore, Capella University, Nursing FPX 4030, Making Evidence-Based Decisions. Remote Collaboration and Evidence-Based Care. In this paper, the research will be based on cystic fibrosis and the related evidence-based practice approach meant to help the healthcare professionals meet the health needs of the patient. The physical location and the medical customs of an individual's cystic fibrosis is a chronic disease. Additionally, cystic fibrosis among various patients is managed depending on the short-term solutions, which have a significant impact on the patient living in the remote areas where access to healthcare facilities is limited and most often exposes the patient to adverse effects resulting in pulmonary exacerbation. The health professionals should as well implement EBP measures meant to improve the management of pulmonary exacerbation and thus improve on patient outcomes. Therefore, limited access to the healthcare facilities by cystic fibrosis patients prevents them to access the medications and the health professionals, which result in poor management of pulmonary exacerbation and poor health outcomes. As a result, this paper will discuss the evidence-based practice, strategies, and prevention measures meant to improve service delivery to patients in the remote areas as applied in the city of Catlin in the Villa Health. An analyst on Caitlin's case. Caitlin's, a 2-year-old patient, was readmitted to the emergency department of Valley Hospital for the second time. At arrival, the patient was reported to have dyspnea and pneumonia and thereafter was diagnosed with cystic fibrosis by Dr. Copeland. After a series of examinations, including the patient's body weight check, sweat, and chest secretions, the doctor has recommended the administration of a pancreatic enzyme and piperacillin IV alongside a regular record of significant symptoms by the nurse during her stay in the hospital. The team did also prepare a treatment plan for efficient and effective care delivery. Caitlin's parents had already divorced and she was left to stay with her mother in McHenry, which is an hour drive away from the hospital. The mother is under a high demand working schedule alongside the household chores which makes it difficult for Caitlin to attend the emergency calls. This makes the situation challenging for healthcare facility and Dr. Copeland, who is in charge. The medical team then set out for a mission in order to acquire the necessary resources meant to improve the health condition of the patient and in the process to connect with Dr. Benjamin, who works in McHenry. A pediatric nurse is tasked by Dr. Copeland to contact Dr. Benjamin and schedule a visit so that he can evaluate Caitlin's condition. Dr. Benjamin is found to have experience in treating cystic fibrosis patients, and he offers to work with the Valley Hospital's team in order to improve Caitlin's health. Then they agree to communicate through direct messaging and Skype. The pediatric nurse is again tasked to inquire about the patient's insurance coverage and the public social worker at McHenry and its ability in catering for the medical expenses of the patient. Later, the findings indicate that Doug's coverage was eligible and that the parents' comparable institutions were proving even social assistance. The medical team then took the initiative of educating Caitlin's mother regarding the smart devices that she was going to be using, including respiratory monitors, weighing scales, and thermometers, which could help her in the effective home-based care of Caitlin. In addition to this, the mother was also introduced to the remote communications such as Skype and direct messaging, which she could use to contact the health professionals. Her access to the internet was an added advantage as it would facilitate her communication through Skype. The medical team did also provide Caitlin's mother with the respiratory information in order to assure her of safe discharge. Application of the evidence-based practice model to assist in creating Caitlin's care plan. The most effective strategy in this case should cater for the health needs of cystic fibrosis patients remotely. Here, the implementation of telehealth has had a significant influence as it protects the patients and their family members from financial constraints, and due to its broad access to the health care services by patients from the comfort of their home. Since its introduction during the COVID-19 period, telemedicine has been effective, even through care for cystic fibrosis patients require the frequent application of specialized equipment and facilities. Patients can as well get access to effective care services even from the on-call health professionals who cannot avail themselves physically. This means that the patient will be able to get the required medical services through the healthcare facility's Skype and direct messaging services, and thus maintain continual communication with the medical team, especially during emergency circumstances and general follow-ups. For instance, for the home caregiver, to ensure that any atypical incidents are managed properly, then the nurse must be contacted through Skype. Caitlin's mother can, for instance, transmit the patient's measurements electronically as derived from the respiratory monitors. This evidence will in turn enable the medical team to make modifications and determine whether the patient is progressing based on the monitors, devices, temperatures, and respiratory indications. This means that the implementation of telemedicine in the case of Caitlin will improve her health condition by ensuring that they are providing the required attention based on the collaboration of various monitoring devices. Telemedicine will, on the other hand, help in managing any other worrying symptoms immediately. Here at the Johns Hopkins model was applied in developing the best care plan for Caitlin. This model specified a decision-making process which a health professionals would follow in order to manage the cystic fibrosis condition of the patient. The model in this case provided the most beneficial technique for decision-making and solution finding. In the process, the health professionals had 4 steps, which included the best optimum means of evaluating the patient's health and thus addressing questions meant to educate people about cystic fibrosis. These questions are: what is the most effective medicine for Caitlin? Will Caitlin's mother be able to access the internet? How can the health professionals collaborate in order to manage any additional severe symptoms? What assistance can the medical team offer remotely? Secondly, the obtained information should be directed toward improving the patient's health. Third, the data is essential in carrying out experiments in order to determine the findings are compatible with the available tools and in recommending the most appropriate EBP measures. Lastly, apply the evidence in enhancing the health status of the patient. Cystic fibrosis is a chronic disease, but the application of various interventions helped in improving the health of Caitlin. The patient was in the first place exposed to the frequent chest examinations and exercises along medications such as aerosols, all meant to regulate secretions and could clog the airways and thus subject her to pneumonia. On the other hand, telemedicine was applied and it significantly improved the patient's health, and this was accomplished through real-time communication on Skype and direct messaging, which facilitated communication between the patient's mother, Rand, and the medical team. Relevant and useful evidence when making decisions. The implementation of medicine and interdisciplinary collaboration was arrived at upon the urgency of the patient's diagnosis. Considering the impact of cystic fibrosis, the healthcare team decided to adopt telemedicine as a result of the busy schedule of Caitlin's mother and due to the insufficient cystic fibrosis facilities, supplies, and equipment at McHenry. Thus, telemedicine helps the health professionals and patients in overcoming the strain of hospital emergency visits, even as it improves the delivery of the medical services and improves patient outcome satisfaction. Benefits and strategies to migrate the challenges of interdisciplinary collaboration to plan care within the context of a remote team. During the chest physiotherapy test, Caitlin's mother perceived that she would harm her daughter. The red spots on the patient's chest were the side effects that caused the fear that this made the mother curious as to whether she was doing the right thing, and she inquired with the medical team remotely. The interdisciplinary team in this case guarantees the patient regular evaluation as to ensure effective home-based care and thus reduce the chance of relapse and hospital readmission. Thus, the integration of telemedicine and EBP measures contributed to the effective medical care delivery and improved patient health. This is the line with the use of Skype and direct messaging, which necessitates real-time communication between the home-based caregiver and the health professionals. Thank you. I hope you enjoy listening to my video for Nursing FPX 4030, Making Evidence-Based Decisions, Dr. Kristen Brager's class. Thank you.